Healthcare in America, a slow-motion disaster with tens of millions unable to afford basic treatment. In 1,000 rural counties, life expectancy is actually dropping. While presidential candidates promise change, free clinics struggle with overwhelming demand. We travel to the forgotten America to meet the people on the front lines.
From the mountains of Appalachia, I'm Avi Lewis, and this is Inside USA. On many core issues, from Iraq to the economy, the United States is a nation divided. But there's one thing most people here agree on: healthcare. It's a mess, and 9 out of 10 Americans say it requires fundamental change. In the election campaign, you hear a lot about health insurance and the 47 million Americans who don't have any. But for people in rural America, just having access to doctors and nurses and clinics can be just as much of a problem. In fact, here in the Appalachian Mountain region, it's one of the factors that led to a dramatic drop in life expectancy, a shocking statistic in a country as rich as the United States. But one thing you never hear about in the healthcare debate is the extraordinary network of free clinics and health services for the poor, being run by people who are filling in the gaps in the system through the sheer force of their own commitment. On this week's Inside Focus, we take a look at the state of health in Appalachia and some of the people who are trying to turn it around.
It's well before dawn in Martinsburg, West Virginia, and many of these people have been waiting all night. As day approaches, the line gets longer and longer. 1,000 will come today. It may look like the lineup for a rock concert, but these folks aren't here for fun. They're in pain, and they're waiting to see a dentist for free.
All we need is a power supply and a compressed air supply, and we can really set up anywhere, anytime, any place.
It's called the Mission of Mercy, or the MOM Project, and when it descends on a remote rural community, it looks like a MASH unit. More than 700 volunteers have turned this high school into a massive dentist office, offering free fillings, extractions, even dentures to a low-income, uninsured population.
I have been here since 4:30 this morning, and I am number 193, and it is now 8:30, and they can't do my dental work today because my blood sugar is in the 400.
In its 8 years, the project, funded mostly by private donations, has treated more than 70,000 rural patients in 10 states. With the country sinking into recession, demand is only going to grow.
Things are just getting too expensive for people to afford, and with gas being where it is, people are going to sacrifice possibly some necessities, medicines, dental, or just even going to the doctor.
The further down the socioeconomic class you go, it's a lottery to get these type of services in a clinic. It's a lottery, it's a wait. So if something happened, God forbid, I would be in an emergency room paying out the nose to get a basic service.
The cost of healthcare, whether or not you have insurance, is a burden borne by all Americans. Healthcare is a massive industry. The top private insurance and managed healthcare companies made $16.5 billion in profit last year, but the market offers little incentive to serve those on the margins. It's no coincidence that the MOM Project started in Appalachia.
And this administration today, here and now, declares unconditional war on poverty in America.
In 1964, when Lyndon B. Johnson stood on a coal miner's porch and launched the war on poverty, Appalachia's economy was the symbol of rural neglect. The very next year, Medicaid and Medicare were launched, providing health insurance to the poor and the elderly. 4 decades later, Appalachia is still trying to buck the historical stereotype. There are thriving cities, new private hospitals, and even attempts to lure high-tech, high-paying jobs. But the war on poverty and the welfare state it established has itself been under attack by cost-cutting governments for a generation. And the result is that in many rural areas, healthcare is going backwards.
We're talking about communities that are spread out, located over hundreds of miles, a couple hours to the nearest provider. It doesn't matter whether you have health insurance or not. You're only going to go see the doctor, the dentist, the hospital when you're truly in physical pain or you know you have a health issue.
In April, the region acquired a grim new distinction. A Harvard University study identified 1,000 counties across Appalachia and the Deep South where life expectancy has actually dropped. The two worst counties are in rural Virginia, where the health of citizens is clearly tied to poverty.
Pulaski in particular has been very hard hit over the last 10 years. And just the main industries that have supported that community dropped a lot of its employees, and with that comes a very depressed state of mind, as well as just in terms of economics.
And all of a sudden, one, they're out of a job, and two, they don't have the benefit. And then they get usually a low-paying job to replace that doesn't have benefits.
Just down the road from Radford and Pulaski is a haven in Appalachia's harsh healthcare landscape, one of a network of free clinics that treat people who live below the poverty line and have no insurance.
It's very hectic. You know, the number of people that come in and need to be seen is just incredible. And we fill up the schedule, but we take in people who are have-tos because we don't want them going to the emergency room as an alternative. So we stay very busy all day.
Helen Robinson is a nurse practitioner at the Free Clinic of the New River Valley. She treats more than 3,000 patients a year. The clinic is staffed by medical students, a few nurses, a small army of volunteers, and Helen. On her day off, she works at another free clinic.
You'd be making a lot of money if you worked in the private system.
Yeah, but money isn't everything. And it's not. I make enough. You know, one thing you have to remember is that your body is undergoing quite a transformation right now. You've gone from how many packs of cigarettes?
3.
To 0.
Working with rural patients, Helen knows firsthand that poor health has a number of interlocking causes. Poverty shapes diet and lifestyle, lack of education undermines prevention, and isolation means less access to both healthy food and timely care. Spending much more time with patients than most doctors ever would, Helen tries to treat the whole person in their culture and context.
Man, you were into something. Look at that. Chewed you up, didn't it?
She's also a tireless advocate for her patients within the wider system.
I have a man that I've been seeing for quite a while now who's a very, very nice, compliant patient and who has made unbelievable changes in his life. And I wondered if there was any way that Dr. Chung could take a look at him.
Butter's the main ingredient of cooking. I know, salt too. I ain't supposed to have salt. Don't tell Dr. Robinson I'm putting salt in them either. She fusses about that.
Clyde may not exactly be a fitness freak, but under Nurse Helen's care and with support at home from his fiancée Loretta, he's trying to turn his health around. 17 days ago, he was still smoking 3 packs of cigarettes a day. Now he's quit cold turkey.
Before, I eat everything that you wasn't supposed to, greasy hamburgers, all that good stuff, and smoked like a freight train, and didn't really think a whole lot much about it, I don't guess, you know. And she got me thinking and, you know, worrying about things.
What's your health insurance situation?
I have none. I've had none since I broke my back back in the early 90s.
Why not?
Nobody wanted to cover you, for one, diabetic, high blood pressure, and back problems. No.
Clyde, who lost 50 pounds in the last year, has some serious motivation to change his lifestyle. Both of his parents were diabetic, both smokers, and both died in their early 50s. Clyde is now 46. While Loretta has some health insurance from her job in a local weapons plant, the crippling cost of health care looms over them. Both have declared personal bankruptcy over medical bills in the past. And a recent trip to the emergency room for Clyde left them with a bill of $8,000.
And I said, "Do you accept food stamps?" And she's like, "No, ma'am, we don't." I said, "Then don't call me back." When it comes to the point and you're really, really sick and you have no other choice, you go to the hospital. You can't go to the doctor and pay $80 because no doctor's going to see you, so you go to the hospital and you pay $8,000. And basically that's what it boils down to, because you have no other option.
The free clinic may keep Clyde out of emergency rooms, but for trips to a specialist or medical imaging, it relies on a network of other health professionals who donate their services when they can, or when they're convinced.
That's great. 10 o'clock on the 29th of July, Tuesday. And, oh, I do thank you so much.
It's a really good place. If it wasn't, I'd probably be dead, I guess, if it wasn't for them. Dr. Robinson, she's excellent. You couldn't ask for a better person. People like her don't get enough recognition. They really should.
Across the state in Richmond, Virginia, there's another solution emerging for those who need health care. Its culture is a world away from that of the free clinic, in keeping with its location.
We have two types of services. We have a get well service, which is a sick visit, and we also have stay well, which are more preventive, blood work, physicals.
Karen Fry is a district manager for Ready Clinic, a new kind of health service based in retail locations like Walmart. It's known in the industry as the convenience care model, and it's growing fast nationwide.
Our goal is to get patients in and out quickly. We don't require appointments, so patients can come in during the daytime hours. We're also open evenings and weekends.
The clinic charges a flat fee of $69 and only deals with easy-to-treat minor conditions like colds and infections. It's at once a corporate beachhead and perhaps a vision of the future.
It's the answer to the healthcare crisis. Patients don't have access, so access is an issue, and we've taken out a lot of the hurdles for individuals.
Sounds benign, but services like Ready Clinic can cherry-pick the easy cases that free clinics rely on to subsidize the hard ones. It's also the latest example of market logic in American healthcare.
We have a pay-for-service mentality in this country. You see the doctor, that's when the doctor gets paid. Doctors, hospitals are not aligned and encouraged to prevent bad outcomes. In fact, you could make the case very strongly that it's in a doctor's financial best interest to see you get sick, because at that point they actually get to go in and get the high payments.
The great promise of the market is freedom to choose. But if you're poor in rural America, many of your healthcare choices are made for you.
Healthcare is not like everything else in a free market capitalistic society. If you buy a bad pair of jeans and they rip very quickly, you just don't buy that brand again. You need insulin shots because you're a diabetic. There's only one provider in the local community providing insulin shots. That's who you're seeing.
You got to have your medicine. What you gonna do? You got to pay it. It's really insane.
Disparities in the system have brought America to a crossroads. The vast majority of voters say it's time that healthcare is available and affordable to all. And the presidential candidates are certainly hearing the message.
Healthcare. I want to give every family in America a $5,000 refundable tax credit to go wherever they want to, anywhere in America, and get the health insurance of their choice.
The very first promise I made on this campaign was that as president, I will sign a universal health care plan into law by the end of my first term in office.
But clarion calls for a new system are not coming from the private insurance and healthcare industry. The status quo may be deeply unequal, but it's also very profitable.
The fact that we are the richest country in the world, and yet we are unable to or unwilling to provide health care for all of our citizens. People are basically treated more as economic units, and it's actually very dehumanizing to think about how our healthcare system is.
And as much as consumer choice is a surefire political message in America today, the heartbreaking reality is that Americans are making choices when it comes to healthcare, just not the ones anyone wants to make.
They're making a decision about whether to buy their medication or put food on the table.
So what do? Do you eat or do you buy your insulin?
Do I take my son or daughter to the pediatrician? Do we go to the dentist? Or do we wait until this tooth starts to rot?
It seems like our priorities as a nation have been kind of mixed up.
You know, we spend millions of dollars fighting overseas. These kids that need doctors and dentists and stuff, why not?
You know, I don't know how many smart bombs you have to trade out for dental appointments, but it needs to be done. It needs to be done. And that's all I need to say. That's a lot of money. That's a lot of money.
It's hard to understand sometimes.
Coming up on Inside USA, more on the health of the nation from the heart of Appalachia.